It's a good opportunity for the three of us to speak to you, to give you the information. So our objective, as we say, is obviously here we are in the digital age, and we fully acknowledge and appreciate all the benefits of technology. And this technology is essential. It's essential in education, it's essential in our way of life. So our advisory board is about how our children, and us as well, can be tech savvy, connected, and healthy. So we share that, I'm sure. So these are some of the members of our advisory board. We have surgeons, Dr. Blank. We have cardiologists. Deborah Davis is a scientist. Many of these are clinicians and researchers. And one of our concerns is that a lot of the clinicians don't have the information they need to make the best decisions for their children, for their patients. So as you may or may not know, and I think Katerina is going to talk more about this, about the natural electromagnetic fields in the earth. But we are exposed to hundreds of millions of times than a generation ago. And these fields are not the same as the earth and the sun. In communicating this message, and we've done this many times in many different groups and settings, the response is often, but we live within all these electromagnetic fields, or everywhere is totally Wi-Fi, so what's the point? Or the third one is, everything gives you cancer, so why bother? So let's move on and see where we can find some ground here of how we can have these kids tech savvy and healthy. So maybe you're the kind of person that believes everything the government tells you. Anyone here believe everything that the government tells you? Well, you never know. Yeah, there are a lot of people that think that Health Canada's on top of the science, and your tax dollars are being used in the best possible way. So many of us assume that government regulations are protecting our children. Would make sense. We also assume that the microwave radiation that's used in these wireless devices surely must have, somewhere along the line, been tested, at least on children, and proven safe. We also hear, and we hear this from some of our local health authorities as well, is that there's no clear scientific evidence of harm. And that people who say they're electrosensitive, they've got some psychosomatic disorder, and that these are not really connected. And the other one is that wireless technology is not only safe, but it's the best option, and it's the only option. So what I want to do here tonight is give you the information, as I do in this book that a team of us wrote. We want you to know what the industry is saying, what the government is saying, what the health authorities are saying, what groups of physicians are saying, what some of the scientists are saying, so that you can make informed decisions. You can make the best decisions for your school district, for your family. You may have heard of Dr. Deborah Davis. Someone actually that came to install I didn't have a smart meter, I got an old analog meter, but in any case, and he said, oh, I've heard about you. And so anyway, he told me that he had heard Dr. Davis, this was a small study, but they found that these women who developed breast cancer, they were joggers, they were healthy, California of course, and they had been carrying their cell phones in their bras, and the breast tumors they had developed were the outline of where the cell phone had been carried in their bra. So Dr. Davis is on a real campaign to make sure people know that there is a risk to carry the cell phone on your body. So when we talk to people about safer tech solutions, and Katerina is going to do that, right up at the top is don't hold it against your head and don't keep it against your body. Dr. Davis has been involved in public health for many years. She was in there in the early days of tobacco. She worked at the Clinton administration. She was the lead scientist with climate change, the Nobel Prize winning with Al Gore and their group. She's an epidemiologist, and she's a scientific advisor for our advisory board. So she says if the cell phone were a drug, it would be banned. So what that means is that there's enough evidence of harm that if you had a drug and you were trying to get it passed, you never would have been able to. And she said iPads are even worse, or can be even worse, in terms of radiation exposure. So Katerina, I believe, is also going to talk about iPads and why they require some special caution. When you take the readings off an iPad, it can be very similar to if the children were lying underneath a cell tower antenna. So part of our concern is that people are unknowingly being exposed. Often I see mother or father, you know, the strollers these days, speaking of high tech, you know, they've got wheels and umbrellas and, I mean, everything. And I saw one woman, and she was putting sunscreen and a hat, and she was cooing her baby and everything, and then gave the baby her smartphone to play with. So if she knew the evidence, if she knew about the strong near field of radiation from that smartphone, do you imagine she would give it to her child? So again, we want to give people the information and let them make the decisions. But one of the concerns of our advisory board is that people are exposing themselves and also putting their children, their families, and themselves at risk without knowing about it. The other concern is that they're unnecessarily at risk. We know that the internet is essential these days, but there are safer ways to connect. So when we want to think of wireless devices, some of the things that I want you to think about is, I have one here somewhere. It's usually in the glove compartment of the car, which is a good place for it. And this is an old flip phone. So embarrassing, my daughter won't even take it to school because it's just too embarrassing. It's quite sad, actually. She has a dead BlackBerry that somebody gave her. She's the only kid she's in high school. I think she's the only kid that doesn't have a cell phone. But she has this dead BlackBerry that she carries around. And I guess when people are out there and she has her dead BlackBerry, but when she goes anywhere, I give her this. And I know she's not going to use it because it's just too embarrassing. But in any case, so proximity. The difference between this and this is huge. Intensity. There's a difference between the amount of radiation that a simple phone puts out to one that has more bells and whistles. Duration. Some of the evidence shows 30 minutes a day can increase your risk of a brain cancer 140%. In an old Interphone study, over 10 years, their idea of a heavy user was somebody who used a mobile device 30 minutes a day. We don't have evidence yet of 3 hours a day. Vulnerability. Children are mostly at risk. Anyone with neurological condition, cardiovascular condition, also more vulnerable. So the concern about children and iPads is proximity, holding them right on their body. Intensity, these are very strong radiation emitters. Duration, how long are they going to be holding these devices? Vulnerability, because of their thinner skulls, more aqueous brains, developing bodies, they're more vulnerable. So this shows how microwave radiation is absorbed to the skull. This is according to age. So this is an adult, the adult skull, how far the radiation, and this is with a 10-year-old. And this is a 5-year-old. So what the evidence shows is that this radiation causes leakage of the blood-brain barrier, which is the protective mechanism that keeps the brain from harm. So when this is compromised, there's real concern for neurologic damage. Co-founder of Doctors for Safer Schools is a cardiologist who has said that very clearly to him, he's seen enough evidence that Wi-Fi signals are simply hazardous to human health. For him, there is simply no question. When you read the scientific literature, there's enough evidence there to show these fields and signals are harmful. We know that many people are becoming electrosensitive. It's hard to tell what percentage of the population, but what we do know is that these numbers are increasing. And also one of the concerns with our Doctors for Safer Schools, our advisory board, is that there are very few clinicians, and believe me, we're asked all the time, could you refer me to a doctor in Milwaukee or Santa Clara or Winnipeg? Because I'm pretty sure I've looked at my symptoms, and they're much worse when I'm around strong electromagnetic fields and I go out camping and I don't have the symptoms. Well, as you know, that's not going to work anymore since we're making all the parks Wi-Fi. So one of our missions is to give clinicians, physicians, the information they need to diagnose, treat, and hopefully prevent this medical condition, electrosensitivity. We have now nurses that can't work in the hospitals. We have teachers that can't work in schools. We have pilots that can't fly. We have police officers that can't be in the police cars. So just imagine for a moment, 5 years down the road, 10 years down the road, how's this going to work? For those of us who have been immersed, sometimes you wish you never knew. Do you ever wish you'd never heard of this? To see a pregnant woman with a laptop so close to her abdomen is to us as shocking as this would be to you. It's just unthinkable that a pregnant woman would smoke and drink. Or let's imagine we were going through the schools with peanuts, or we wanted to put lots of asbestos in the school. So one of the concerns is that there is evidence of harm. So when these kids are texting, now texting is safer than talking, right? Because remember, proximity. But just because texting is safer than talking doesn't mean that it's safe. I'm going to go through this evidence of harm fairly quickly because I believe Dr. Blank, who's a scientist working in this field, is going to talk about this as well. I have reference to this at the end. So these are some of the effects that have been shown to be a result of this electromagnetic radiation exposure. So not only DNA damage, but disruption of the DNA to repair itself. And are you going to talk some about, mention it tonight? Disruption to the normal functioning of neurological, cardiovascular, and endocrine systems. I gave a lecture some years ago, 4 or 5 years ago, at a American Academy of Anti-Aging Medicine. And there was a Dr. Klinghardt, I'm going to talk about him in a minute, was there in the audience. And so I was talking about some of his research. So then I said to the group, I said, well, actually, Dr. Klinghardt's here. Perhaps he would come up. Big mistake. No, not really. Anyway, so he comes up and he goes, and you think the three of us are intense about this. I want to lay Dr. Klinghardt on you because he is a clinician. He's worked with thousands of electrosensitive patients, and he is so concerned and so sure that we are creating harm and damage. He's particularly concerned about prenatal exposure, And so he said within 15 years, we will have no neurotypical children born. So I said to him afterwards, I didn't say anything when he was on stage. Afterwards, I said, could you not have just hedged that just a little? Like, you know, within 20 years, maybe, you know. He said, no. He said, you show me a pregnant woman who's not in a Wi-Fi environment at home, at work, Bluetooth in the car, who doesn't use an iPad or a mobile phone, who doesn't have a digital cordless phone. It's everywhere. There's clear evidence of harm. So the leakage of the blood-brain barrier, this was done by Professor Leif Salford. These are published, peer-reviewed, replicated studies. Sleep disruption, if you think that you may be electrosensitive, sleep disruption can be one of the primary symptoms. And sort of drug-free, you may have difficulty sleeping. Suppression of the immune system, and impaired cognitive functions. Again, when we look back, I don't know when we're going to be looking back, but we are. We're going to look back to this time. I asked Dr. Blank one time, I said, are we in the early days of tobacco? And he said, no, actually, we're more like the early days of asbestos. So when we look back, it's going to be extraordinary to us that we gave little kids these things, baby apps. They say, you gave them to kids? And not only that, we provide them for children on the autism spectrum because the iPads are such great educational tools. But we're also going to be kind of incredulous that we had these wireless devices in schools, because there is evidence that this microwave radiation particularly causes cognitive impairment. It affects memory and concentration. Professor Muskeler is one of the researchers, University of Vienna Medical School, and I talked to him at a conference, and he said, well, what we find is with this radiation exposure, people make worse decisions quicker. So I used to work in the aviation industry, so one of my, I'm carrying so many flags and banners, is Wi-Fi in aircraft is really not a good idea. Do you want your pilot having cardiac symptoms and cognitive impairment? I don't think so. So here's some of the symptoms. Part of the concern is, this is like also the early days of fibromyalgia, chemical sensitivity, multiple chemical sensitivity, that there are so many potential related symptoms, people tend to dismiss them. But the heart is electrical in nature, and it is particularly vulnerable to this exposure. Cognitive impairment, we talked about. Dizziness is certainly feeling faint. Headaches, well, there's hundreds of things that produce headaches. But it can also be from the wireless device, from the router, or being too close to electric or magnetic field. Low immunity, muscle weakness, nausea, vomiting, ringing in the ears. Some people are like little detectors themselves. They can walk through a place and they go, oh yeah, Wi-Fi here, I can feel it in my ears. Or they can feel how their heart rate changes. And also, many people get skin rashes, tingling in the hands. So when I first got involved in this about 8 years ago, I guess, I asked a Dr. Hans Scheiner, who has already been working in this field for many years. And so I was asking him about electrosensitivity. He was one of the contributors to our book. And I said, are these, you know, the miners and the canaries, are these people just more sensitive? Are they the only ones that are being harmed? He said, the evidence shows everyone is being harmed. Some are more sensitive, some are more aware. So as I said, the rate and rhythm, sleep deprivation, also causes inflammation and free radical damage. Can be a factor in anxiety and depression, hypertension, ringing in the ears, headaches, as we said. So here's the quote from Dr. Klinghardt. And he actually went around when he was working with a group of women whose children were born with neurological damage, some on the autism spectrum. And he went around to where they lived when they were pregnant. And he took readings of the electric fields, the magnetic fields, and radio frequency. And the radio frequency was very low. And he found there was a high levels of electromagnetic fields in women that had had children with these conditions. We're not trying to establish a link, but there is some evidence, there is some thought that this may be a factor in autism spectrum. It might be to do with the cell membrane, the ability of kids to detox heavy metals. Neurological conditions also there. So this is the book. We have a series of contributors, and these are some of the references. So the message is, as far as I can tell, the government regulations are not correct. And Dr. Blank, one of the reasons that I wanted to speak before Dr. Blank is, Dr. Blank is a scientist. He's published over 200 papers in this field, and he's a professor at Columbia University. You want to pick up one? So there are many of us in this that are the message carriers. But Dr. Blank has done this research. He has seen the evidence in his own laboratory and has been working in this field for many years. And I don't know if you could say there's scientific certainty, but I would certainly be interested in what you have to say. And also, he was one of the authors of the Bio-Initiative report, and they looked at the regulations. One of the concerns is whether it's your school board or the library board or the trustees or the manager of the hotel, the response when you bring up concerns is these levels of exposure fall well within the government allowed levels. And they're absolutely right, they do. The problem is those levels aren't based on the science, they're not based on these kinds of exposures. And as Dr. Blank and his group at the Bio-Initiative has shown, they are not protecting us.